Okay, so just opening the meeting, we've met quorum. So I'm going to get started. And welcome, Sarah.
Thank you. Thanks so much for having me.
Glad you're here. Members of the public wishing to participate in the meeting must use their full name for Zoom access. If full names are not used, people will not be allowed to participate in the discussion. The town reserves the right to remove any member of the public from the meeting who does not use a full name or acts inappropriately. As a preliminary matter, this is Athlyn Sweeney, the chair. To permit me to confirm all members and persons anticipated on the agenda are present and can hear me. When I call your name, members, please respond in the affirmative. Veronica?
Here.
Suzanne? Just unmute, Suzanne.
Now it's unmuted. Here.
Thank you. Sue?
Here.
And Tara?
Here.
And staff? When I call your name, please respond in the affirmative. Jericho?
In attendance.
Anticipated speakers on the agenda, please respond in the affirmative. Sarah Wright?
Here.
Thank you. Good afternoon. This is the open meeting of the CHS is being conducted remotely pursuant to Chapter 20 of the Acts of 2021. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting, are we featuring public comment? Will feature public comment. For this meeting, CHS is convening by video conference via Zoom app as posted on the town's website and identifying how the public may join. Please note that this meeting is being recorded and that all attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and take care not to share a screen on your computer. Anything that you broadcast may be captured by the recording. All supporting materials have been provided. Members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I, the chair, know otherwise. We are now turning to the first item on the agenda. Before we do so, permit me to cover some of the ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I, the chair, will introduce each speaker on the agenda. After they conclude their remarks, the chair will go down the line of members, inviting each by name to provide any comment, questions, or motions. Please hold until your name is called. Further, please remember to mute your phone or computer when you're not speaking. Please remember to speak clearly and in a way that helps generate accurate meeting minutes. For any response, please wait for the co-chair to yield the floor to you and state your name before speaking. If members wish to engage in a conversation with other members, please do so through the chair taking care to identify yourself. After members have spoken, the chair will afford public comment to those members of the public that have joined the meeting via Zoom. Members of the public who wish to speak must state their names and be acknowledged by and speak through the chair. Finally, each vote is taken in this meeting will be done by roll call vote. Do I still have to do the recorded one I have?
I do think you do.
I think I do. Okay, so
that's the one with the update to. That's the one that mentions 2025, right?
Yeah, except for I still don't have the 2025 date in it. So as noted, it is till 2025. But I will go ahead and play the extension, which I do a little bit speeded up. So bear with me. On July 16th, 2022, Governor Baker signed into law an act relative to extending certain state of emergency accommodations, which among other things extends the expiration of the provisions pertaining to the open meeting law to March 31st, 2023. Specifically, this extension allows public bodies to continue holding meetings remotely without a quorum of the public body physically present at the meeting location and to provide adequate alternative access to remote meetings. That does not make any new changes to open meeting law other than extending the expiration of the temporary provisions regarding remote meetings. Okay. And so our first order of business is to close the last meeting, adjourn. And if somebody so moves, we can close the meeting.
I so move.
And do I have a second?
Second.
Tara, thank you. And now by roll call vote, Veronica,
Aye.
Suzanne,
Aye.
Sue,
Aye.
Tara. Aye. Aye. The last meeting is closed. Thank you. The first item on the agenda is for us to discuss the CHS interest. If anybody knows of anybody who's interested in joining CHS, I believe, Jericho, do you want to tell them kind of like who's closing out, what openings we're going to have?
Yes, let me pull up the expiration date from the town, but I believe we have 3 members leaving. Some of them are members we haven't seen in a little bit, so I think it is Claudia and
Jennifer.
Jennifer. Jennifer did express interest in reapplying. We just need to get her to submit the paperwork for that.
Oh,
And then also Cindy as well. Her term lapsed and did not send back in.
so let me
So-
make sure I understood you correctly. Jennifer is interested in continuing? Okay, so
She
that
ma-
would be 2 spots.
Yes.
Okay. Now, am I correct that we might have 1 still open though, that we never filled the full 9, which you're shaking your head, Veronica?
Yeah, we're still down 1.
Okay, so that does mean if Jennifer applies again, that we'll still have 3. Sue?
On the website, I think it's still listed Jocelyn. Is she still a member?
You need to unmute Jericho.
She is not. And I did reach out to her to see if she wanted to continue. She does not.
Okay, thank you. So we need to fill 3 of the seats. Does anybody have anybody they think might be interested in joining the committee?
I'm at this point trying to shake the bushes, but I haven't gotten anyone. Maybe we can talk a little bit about what the scope or parameter, because we have people who are full-time residents. We also have people who are taxpayers, but maybe seasonal residents, and all are eligible to apply for Council for Human Services.
But not for the CRC.
Not for CRC. That's the issue, that you have to be a voting member of the community for CRC, but for Council of Human Services, I have a neighbor that I am reaching out to that will probably become full-time within the next 18 months, but is here all summer and is involved in education in New York, that she's expressed some interest. So I just need to sit face to face and basically explain what it's about and why I think she could potentially do this. I have a question for Jericho, because the cycle for the town application is over, because those appointments in that batch are being done by the end of June. Do we have to wait for the next cycle?
Yes, but there's I believe there's an additional cycle. It goes twice per year. So there's another chance to add people on this year. I believe it's August to September. I'll have to double check that, but I know that we added people twice last year and we added people twice my first year as well.
Okay.
So I think, Veronica, since we are having minimal meetings over the summer, if we wanted to have anybody email possibilities, and I think you should reach out and talk to the person prior to emailing us the name. If there's anybody who you all think could be a good fit and have the interest in the time, to email it to Jericho, and then Veronica, you and I could work together to reach out to the individuals and then maybe meet them for a coffee and talk a little bit about what we're doing.
Okay.
How
I
does that
will
sound,
note,
Jericho?
I will note that this organization is open to all, basically all residents of Nantucket. So subtle nudge, Sarah, how are you doing? I know you want another meeting, but to my knowledge, we have not had a hospital staff member on any of these meetings in the past. It might be somewhat helpful. Just throwing that out there, putting you on the spot immediately
Just
after you
think
join the
about
group.
it. You don't have to answer here.
No,
Um,
I so appreciate this, and that's what I am listening to the conversation. It's delightful to meet all of you, of course. And I'm here to throw my hat in the ring if would be helpful. So you can do with that what you will. I'm very familiar with town government, small town. I came from the Berkshires. I was the moderator for 3 years. I know how these things, we went from a representative to an open town meeting, and so I know what this is all about. I do. And I've been a social worker for 30 years. So here I am,
Great.
the new director of social work at the hospital. The hospital knows that I'm on the Zoom call. It's all copacetic, and I do, that's what I really said to you, Jericho, a couple months ago was, I still own a home in the Berkshires, and there are just all these tiny towns that cannot function anymore because they never have a clerk, they don't have a full school commit. I mean, you all know this. So here I am.
Wonderful. Go ahead,
And,
Veronica.
and a positive is for participation. We are doing our meetings by Zoom, and at least for the next 2 years, Zoom meetings can continue. So if you're not on island or traveling, I think that we make it as convenient as possible. And someday we will have a live in-person meeting, but this is a way that we do get participation. And so that should not be a hindrance for anybody. So.
Yep. Thank you, Veronica. So do you guys think it's, instead of discussing it here, it's better for you guys to kind of give it some consideration, talk to people, and then email Jericho? Does that work? Okay. Great. So let's move on to the next agenda item, which we need to actually, so let me explain this. We need to vote again for our 2 members on CRC. So I know, Sue, we just recently voted you on, but it has to do with the inner workings of CRC. So both Veronica and Sue are willing to continue their work on the contract review committee. And Sarah, for your knowledge, the contract review committee kind of gets the pot of money from the town that's dedicated to social services on the island. And they do this entire process where they take in the requests for monies, they look through everything, and then they decide how to divvy that out, or sometimes not divvy that out to certain people and help them get to other funding sources. So just so you know what that is and what we're talking about. And this particular year, there is kind of an offshoot from that, which will be later discussed, that's about a youth behavioral pocket of money. So if we can we do them in one lump sum, or do we have to do them each individually?
You can do them both.
we can
Just
do them.
move a movement to nominate Sue and Veronica to serve as Council of Human Service representatives on CRC.
Right,
be
so
all
I
you
just
need.
need a movement to vote on Sue and Veronica on the CRC. Can I, thank you, Tara, and can I have a second? Thank you, Suzanne, and by roll call vote, Suzanne?
Yes, aye.
Thank you. I vote aye. Veronica?
Aye.
Tara,
Aye.
and Sue.
Aye.
It's unanimous. You're back on. Thank you both. It is a lot of work, especially this year with all of the special things going on. So we really appreciate both of you being willing to do that heavy lifting. It's a big deal.
Thank you.
Thanks. Okay, and so we have moved the Human Service Directors section up to number 6. So that's Jericho, and I believe Jericho, you're going to have Sarah take the floor.
Yes, if you just want to do a little introduction and anything you feel like sharing about the the hospital social services department. And then as soon as you're done, just let me know. I'll do my brief presentation.
Okay, great. Well, I do feel a little torn at the moment because my boss is calling, but it's all good. It's all good. No, thank you so much. I have been here since mid-February, as I maybe indicated, and there was, I think you probably, most of you or all of you perhaps know that there was kind of a number of months between, you know, the prior director and maybe an interim person. And everyone here apparently is named Sarah in this department. So, so Sarah Chakowski, it's funny, she's in the Pioneer Valley where I also lived a long time ago, and people think, you know, it is Western Mass, but anyway. And then Sarah Thomas, who I think is she is a traveler from, I don't know, like the deep South, maybe Alabama. She's returning on Monday. I met her back in mid-October when I came to interview. And one of the other staff social worker right now is on leave for a few months. And I still have a traveler here who's extended twice now through the end of September. So I think that with the traveler I have, with Sarah Thomas returning, and with Sarah Chakowski still graciously answering questions here and there for me, you know, I'm getting my sea legs, as they say. And what else was I just going to mention? Oh, I have housing. I mean, that's like, I think, you know, the best thing, right? Thank you, right?
Everybody.
And it
will
was just
celebrate that.
word of mouth, you know, word of mouth through the director Pascon. So that was really super. And I guess that those were the questions.
Can you tell us a little bit about the travelers, because that's a little bit of a different structure than the hospital has typically done for the social work department, not necessarily for nursing and some other positions, but it's new for the social work department in the hospital.
Yes, of course, Evelyn. I think that I don't know the whole history of it, of course. So I just know that we have this traveler who's extended twice. You know, the HR department manages all that recruiting. And so the person who is the traveler right now is from the North Shore of Boston. So she is from Massachusetts, which is, you know, helpful because I think she went to grad school in Texas, but she's here. She goes off island to see her family in Beverly or something.
And is Sarah Thomas?
I'm sorry?
Is that Sarah Thomas?
No, that's Mackenzie Swenson. Sarah Thomas is she's coming back, but she had a break, you know, so I don't know if she was working or if she traveled somewhere else. Mackenzie has, you know, she's been here since I think the beginning of the year. She extended once. And so she'll end up being here, I think 9 months thereabouts, which is great for continuity and given everything else. We also have, starting on Monday, we have an interpreter coming from Greater Boston who has been here before. I know I think she's going to work 4 days here in the hospital. I have to double check. She's going to work in a restaurant too, which she worked in last year. So I think she's already fairly familiar with Nantucket. She's fluent in Spanish. And so that's pretty much everything I know.
Now, with the changes, and you might have specific questions, Jericho, but I just figured I'd hop in there. You went somewhere, so. With some of the changes that have happened for Fairwinds taking over the crisis contract, and I'm not sure if you were around, it was sort of like right at the apex, I guess, of you getting here that they took it over. So the hospital was doing the evaluations for crisis, and now it's my understanding that Fairwinds are doing those. Are there any that you are still doing, or are Fairwinds taking care of all of those?
Well, it's funny, I just saw Amanda Wright before I came to hop on here, and she and I are not related, just so you know. But anyhow, so we have, for example, we have a pediatric patient in the emergency room right now who needs inpatient. And so what happens is the pediatric patients, once they're boarding, they move over to the med surg floor while they're boarding. If they're adults, they stay in the ED. So the arrangement that we have now, and I'm sure this is all, it's all written down, policy checked and contractually safe and so forth. So anyway, so I will see this patient tomorrow and do the mental status update because he'll be physically in the hospital on the med surg floor, which I cover anyway. I came from, just, it might help to know, I came from Bay State and I was in the ED as a behavioral health, clinical coordinator when just the opposite thing happened. So Behavioral Health Network was the third party vendor doing all the crisis evals. There's no other way to say it. I don't mean to, they just imploded staffing wise. And so they were contractually obligated through the end of December, but didn't make it past December 5th. So we took the hospital staff took the whole thing over. And of course, that hospital ED is larger than this entire hospital. So in any case, that's where I came from. And before that, I was at Berkshire Medical Center and so forth. So yeah, I think the arrangement with Fairwinds is, it's great. I think it's a very good working relationship. Amanda and I we're starting to have regular lunches so we can make sure we're, presenting really as a team, which of course we are, and just making sure that we learn as this is all new to, I think, to this entity and to their organization. I've met Jason recently. I think I met him on election day, in fact, here in Nantucket. So
I think I'm pretty sure I met you at one of those lunches you and Amanda were on.
oh, okay, fair enough. Yeah, and then the collaborative things that the foundation does, I've been to one of those in person and I'm going to try to get to the next one. And so I'm just trying to, find my way here and have certainly, connected with Janice Carrero at Nantucket Food Fuel, obviously connected with Jericho, but also, was it Brooke Moore at the Resource Partnership? Is Tracy I don't think I've actually met Tracy or spoken with her, and folks at A Safe Place, and I just took some supplies, items that we had that we couldn't use here in the hospital, but I walked those over to Health Imperatives yesterday. So, I'm starting to find my way.
Very good. Does anybody have any questions? Veronica?
Sarah, could you describe the scope of what the social work department does?
I'll try.
Okay.
Yes, so it is very unique, I think, this setting, right? And what attracted me so much to it is, obviously Springfield's not rural, but Berkshire County has one health system from Vermont to Connecticut. So there's a lot of kind of similarity in terms of geographic isolation, frankly. I think parts of North County there are truly medically underserved, whereas I don't think that's the case here because the geography is different. And you have this rural health clinic, which I think is awesome. That's what I think is, I mean, I think all of it is great. And I will say again that I'm super excited that we now have a rural affairs director who started in Healy's administration on Monday, which I wrote about for the Berkshire Edge, just sidebar. And but anyway, you know, that position is, of course, just within the Office of Economic Development. Healy split out the housing into housing and livable communities. But anyway, one of the things I argued in a piece I just wrote for an outlet out in the western part of the state is that I think eventually Ann Goby is going to have to get involved with rural health, which of course there is a statewide office for that, but I don't know how she can't, because because health is part of the economy everywhere you go, right? So, but it's so interesting because, you know, she's from Spencer, Ann Goby, so she's from Central Mass, and I think most people that I know, you know, don't think of Nantucket as rural, don't think of Nantucket as needing anything whatsoever. And so to your question, I do think that there are some real palpable, visible, and also invisible and maybe not vote, but there are real social work needs here. So I come in every day and basically go to the med surg huddle on the floor. I walk through the ED, do rounds throughout the day. Now that I have someone out on leave, Mackenzie and I are divvying up the dialysis patients who, you know, come 3 times a week. So I see half and she sees the other half. And that's you know, this is how many there are at the moment. And then we have a work queue in the electronic medical record where the clinic providers just say, you know, this person's lost a bunch of weight, you know, can you see if they have food insecurity or need anything? This person, you know, is having trouble paying for her very expensive cancer medication. You know, she's 64, of course, they're always 64 when, you know, like they just have to get to Medicare age, right? I mean, it's just, but anyway, so I helped somebody yesterday. I think she's going to get up to $10,000 a year of support, but you know, her medication costs are like $50K a year. So it's good. It's like, that's a win. That's a small win, but it's also, you know, that's a patient who goes to Dana-Farber too, twice a year. So I think at a certain point, I'll connect with the Dana-Farber social work too, just to make sure we've got everything covered. But again, here in the hospital, this department oversees the language services, interpreter, translation, and there's another piece to that. The virtual stuff, I don't know, there's a whole bunch of other things. So, I mean, that's what I'm doing now, day to day, and then there are committees, and then there are other things that just pop up.
Are you guys working with the doctor's offices? Like, so if they had somebody in who was, you know, maybe pregnant, having signs of you know, any kind of prenatal mood regulation issues, do you also respond there?
Do you mean labor and delivery, Evelyn?
No,
Or-
to the no, not L&D, but to the doctor's offices within the hospital. I know.
Yes, like Nantucket Cottage Medical Group here at the clinic. Yes, that's basically what it's called the work queue in Epic. It's those providers. It's a consult or it's an order referral to NCH ambulatory social services because they're outpatients, right? And then that's a good point though. I work closely with Deb Dolan at Pascon and even Dr. Lepery's office, you know, I've been working with one of his staff. There's a patient on island who's homeless. And of course there isn't a homeless shelter here. But he's going off to MGH. He'll have surgery and wants to make arrangements for post-surgical recovery in a specific location, right, in Boston. So we've been trying to do our best to set that up.
So
Thank you.
basically, all the things associated with the hospital, from urgent care to
Yeah.
the medical group to inpatient, you're working all of those systems.
I guess so, yes.
Congratulations.
Thank you.
It's almost like it just hit you. You're like, yeah, I guess I am.
If I can, if I can clarify, just the key is whoever you're dealing with, the common factor is they have a medical issue also.
Yes.
Okay.
Hmm.
Mental
So
health
however,
included
however they
is a
come
medical issue.
in, either through a doctor's office or through the ED or ambulance, whatever, that would fall under your umbrella.
Right. I mean, I would say, Veronica, that, obviously there's family work in social work practice. So, we have, like, the patient is the index, that's the point person, right? But you're right, everything flows from that. So I might get a call now or a walk-in tomorrow who's not a patient and is grieving the loss of someone who's gotten sick or passed or, whatever, and just needs some support. So that person's not medically referred, but we want to do right by the patient. And I think that is supportive of the patient. In most cases, that's the goal.
Mhm.
Okay, Tara, you had a question.
I didn't think it would, I didn't feel like I got a good definition of what a traveler is and what a traveler does. So I just wanted to see if you could clarify that for me.
Sure. So that's a good question, Tara. Thank you. So before all my hospital work, I started a company a long time ago, sold it later, right before the pandemic, called Social Work in Progress. That's what it was called. And I basically had a small team of social workers. Mostly Greater Boston is where we covered, but we had contracts all across the state, some in Rhode Island, some in New Hampshire. New York kept calling at the end and whatever. But social work departments, like in this setting, and we were mostly in post-acute care at that time. So social work departments are small. Like if you go to Boston Children's Hospital or MGH, like they have 200 social workers. But in all these other spaces, it's like you can count on one hand. So when one person is on maternity leave and the next person is on medical leave and the next person gives you their notice and the next person has jury duty, it's like, something has to give there. So I used to say there was always a pregnant social worker somewhere and it was never me, but that's really how that's how that business started. And so we would just travel to all these different nursing facilities, so many of which have also since, but anyway, because for regulatory compliance, they would need to have, certain kinds of paperwork done, certain kinds of structured interviews, certain kinds of counseling and interdisciplinary teamwork to, for the Mass Department of Public Health, CMS, and what have you. So the travelers who come here, it's the same concept. We have to have, a full staff complement, however that is arranged. And, like
How long do they come for? What is usually
Oh,
the
yeah.
standard time?
Yeah, they usually here, I think it's 3 months minimum. So 3 months minimum. And, again, HR manages all that recruiting, all those contracts and all the, benefits and all the other stuff that goes with that. Payroll and workers' comp, all of it. So, and they, I think they are mostly whatever housing the hospital arranges for them. So again, I think it's just like travel nursing or travel, the ED is travel medicine. And, for example, Mackenzie's off on Monday and Tuesday. So Sarah will sort of be flying solo Monday, I don't expect like there's going to be a deluge ever, but people keep telling, and I know I can see that there are more people every week on Nantucket. So I'm just not sure, and I've been told actually that even though the hospital's volume goes up, the social work caseload volume doesn't go up proportionately. So that, I think that's good, but I also think that it you know, all the more reason you want to have the resources, the human resources on deck.
Mhm.
Could I ask just a quick follow-up? Do you have the ability to have almost like if you have that scenario in which all of a sudden you're down to not, do you have almost like an emergency backup plan?
I'm certain that that it's HR. Yeah, and I don't think, I mean, I certainly have given thought to this too, Tara, because I just know it so well. I've seen that story play out. So one of the things I was going to do today, but will do tomorrow, I'm going to talk with my HR business partner to ask about, really directly developing some kind of relationship now with the recruiter, so that because that's how it works. The recruiters, if they know you and if they know exactly what you're looking for. And also, I think that this place sells itself, especially for a younger social worker, perhaps, who, doesn't have, school age kids or family elsewhere, like, they can come here for 3 months. They might like it. They might want to, stay permanently. So if that's the case, then great. And I know that when Sarah was here, Taylor and I think David were all lived on island. And that's my goal, is to get back to that, is to not need travelers in this department, because there is still that inherent, churn and turnover that is not ultimately good. But I always, some social work is better than no social work. So
Okay, thanks, Sue. You had your hand up next.
I did. Well, I just wanted to say, you've mentioned 2 of my populations already as examples. I am the managing director of the PASCON Foundation. And so I have been very delighted to hear from Deb how she's finding you are very accessible for PASCON patients. And so our foundation thinks that's great, and we're really appreciative of it.
thank you.
It's made a world of difference for PASCON. And then I'm one of the steering committee members of the Warming Place. So we work with the unsheltered folks in the winter. So hopefully we'll connect in the fall when we're about to start our operations again, because we definitely share some clients, and it's nice to hear they're getting some more attention through social services.
You're
When
too
it's-
kind, Sue. Thank you. Thank you so much for that. I have no idea where the Worming, I'm like, that was my big struggle at first. I have a car here and everything, but I like the signage is really, challenge. Like, I have no idea where but now I know, because I've driven all around, and I know some places are obviously like a safe place, and some things are sort of anonymous. I'm going to try to bike the whole island between now and the fall. So hopefully that will help too.
I've been here 10 years and I have not driven every road yet. Takes a while.
I was born and raised here, and I know maybe 15% of the street names.
Trying to give directions is a challenge.
Oh, it's by that thing that happened that one time to that one
That's
dude
right.
we all. Oh, you don't know him? Oh, sorry.
Oh, sorry. Suzanne.
I was just saying ditto. I was born and raised here. And I know, while I know a lot of the streets, they're adding new ones all the time. And sometimes there are 3 named Sylvia Lane, So, I mean, that was the case when I built my house, and I said, no, it's not going to be Sylvia Lane. I can't deal with that. So
Too funny.
Sarah, was there anything that you thought of while we were asking questions that you thought was important to add?
I don't think so.
That's
Not
okay.
right
You
now.
don't have to. I just
Not
wanted to
right
make sure to give you ample time to tell us
Thank
about
you.
the position and
Thank
the
you.
hospital and new things that are happening there. And it sounds like you're doing a wonderful job connecting and starting
you.
to create your network on Nantucket. So
Well,
thank
I'm just so delighted that this worked out because I know that it was a little last minute. So I really appreciate your willingness to include me tonight.
And you're always welcome to come on and listen because we have speakers each time. So if you happen to see somebody on the agenda coming up that you haven't met yet, it might be nice to hear them present.
And
Great.
additionally, if you ever have anything you want to share out from the social services department at NCH, you can reach out to me, and this can be one of the platforms you use.
And
Very
Jerry,
cool.
a quick question, just in case Sarah or anybody for that matter, not just Sarah, if they have just an announcement they want us to make here, but they can't join the meeting, can they send like a blurb along to you that we can share with the public through the meeting?
Yeah, absolutely. We can, so just in general, if there's anything that you want publicized around the town, be it programming, be it volunteer opportunities, anything like that, then you can send that to me. I can amplify it out through town social media. I can throw it on a town website, and we can do some MailChimping if necessary.
Great.
Thank you
Um,
very much.
I will do the remainder of my update very briefly because there's not a whole lot to report right now. I did an update on some air quality earlier. That's something to be aware of. Nothing crossing any particularly dangerous thresholds unless you are specifically have a medical condition that makes you vulnerable to respiratory contamination. COVID is wobbling around 0 noise right now, according to the last 2 wastewaters. Anecdotally, there have been an increased number of cases in MAVEN, which is the state epidemiological reporting system, of a couple of increases in communicable diseases, primarily some RSV, some flu, a little bit of COVID, and potentially some chickenpox that we're following up on.
And we have a new tick, right?
What's that?
I said, and we have a new tick.
Oh yeah, did the Lone Star finally land? I've let Roberto deal with ticks because I hate blood-sucking animals, basically. More
Yes,
than
we
yeah.
have confirmed. Let's-
Yeah, it was going to happen anyway. Probably the number one public health threat on Nantucket on an ongoing basis is tick-borne illness, and tick-borne illness and sun exposure, ironically. Then other than that, we have fully incorporated the community solutions for behavioral health. That will be the permanent name for the Nantucket Behavioral Health Initiative / what was called the GPS Gaps Study. That will be an independent 501c that will be posting hiring notices for an ED shortly. There's 2 or 3 work groups going on there. As a sub part of CSBH, both the hiring committee and then we have a continuum of care group, which is doing a survey of existing services on the island and where they fall into the continuum of care. God, I hate using this term, paradigm that we've been using to inform the study of the Nantucket behavioral health system. We should be having some recommendations out for that. CSBH also secured a tower grant, so they are funded for the next 3 years at the very least. Past that, I'm building out a couple of service options with the new community health nurse, Erin Schrader. Erin used to work for, I believe for NAMI. She was also a nurse at the hospital for the last couple of years. I will be bringing her here to do a introduction discussion of what services we're going to be expanding into. Probably going to be in the fall when we have everything tied into a bow and have our various standard operating procedures put together. Past that, nothing particularly fascinating. We're launching a data migration project for the Health and Human Services that I will not bore you with any of the details on, but that's about it.
Jericho, I have a question for you. Recently, I know some risk has gone up around suicide. I'm wondering, I know that the SOS program is done in the school, Signs of Suicide is done at the high school level. Not sure if it's in the middle school level. I can't remember. I believe it is, but I believe it's a 9th and 11th grade process that Fairwinds has continued to do at the school system. historically, Fairwinds also did some community free training around, I think, question, persuade.
QPR,
refer.
yeah.
Mhm. Do you know if
Um,
that's still happening?
I think that they're still catching up with the expansion of the CSBH and crisis projects. I know that there are always ongoing, what is it? It's a behavioral health first aid course, which is related to QPR, but a little bit more extensive. I know they do ongoing individual trainings for that, but those are for adults. The SOS, and I think there was an abbreviated QPR educational curriculum that was introduced to the school a couple of years ago. I do not know if that is still ongoing. We were trying to get a behavioral health first aid voluntary training system in for students, but the certification for that ended up being somewhat complex. And then it was and remains difficult to get programming into the school, given the limitations they have on staffing and the other
I'm
issues.
really looking at more of that middle age to higher age male, worker on Nantucket. So it would be more thinking about putting heads together about how to restart some of that kind of free training and making it accessible through the community. I think it's something we should discuss.
I know that that was earmarked as one of the first priorities for CSBH, both in terms of grant funding and in terms of like advocacy proposals for the incoming ED. Also, if you have any organizations you know of that can offer that, that are 501Cs, I would very, very much like you to apply to CRC at the end of this fall. I'm going to be trying to push for some more community-wide programming that gets funded through that source. So that is the sort of thing I would love to see come through there. Additionally, I know that both NAMI and ASAP are offering those QPR courses and behavioral health first aid courses, but I don't know what the schedule or intake is for them. Eventually, we'll be, so actually another tiny bit of announcement from me is that Ann Medina, who is the Human Services Business Coordinator and Office Coordinator, will be retiring at the end of June. Actually, she'll be retiring on the 30th. So we'll be hopefully rehiring someone who will be attending these meetings. And then we'll be kind of trying to build out a little bit more of a policy writing and outreach component into that position going forward. So this is the kind of thing that I would love for us to kind of push for a little bit more town participation and funding in the kind of communal or community-wide based programming or education.
I'm wondering, since Fairwinds has done it and NAMI has done it, if they would potentially partner in doing something, at least with the Builders Association, sort of hitting, because we have so many men working in the trades. I'm just thinking of how can we quickly get something in and not wait. I mean, I know I hear it's on people's agenda. I just hate the idea of even waiting. And I know it's been done. It's not like people don't know how to do it.
I know we can do messaging pretty quickly to the Builders Association. Is the concern that there might be a potential ideation chain like there was a few years ago?
Well, the idea would be to get ahead of anything like that. Like not waiting for it to identify it, but saying there's been enough now where it's like, let's get ahead of it.
Yeah, no, I do think that specifically is a programming option that we could do. The trouble is I need a subcontractor to do it. And the additional trouble is that I need my funding release is relatively constrained. I do have rural
So
health,
NAMI is a 501c3,
but
right?
unfortunately the grant cycle and fiscal year limits my ability. So if someone came to me with a project for this, the absolute soonest I could fund it would be fiscal year 25.
Oh, wow. Well, we're not going to wait that long.
Yeah, I do have the Rural Health Equity Grant that I can use to jumpstart programs. If there is a qualifying 501c that meets with the relatively mellow requirements that this particular grant has, then send them my way. And I can help work with that. I can't make any guarantees as to that, as it's sort of
So
a
if I
case by
had Jackie
case.
reach out to you from NAMI, Jackie Lane.
I
to
speak with
discuss-
Jackie relatively regularly. If she has a proposal for funding a project, then we can probably work something out on that. But these funding totals are like the amount accessible through this rural health grant is significantly less than CRC by like a factor of 10.
Okay,
So it's really more like jumpstart financing for programs that then can transition on to applying for.
right, so
conventional
it could be
grants.
the initial question, persuade, refer, and then come up with another plan for continued. Okay, Suzanne,
I have a question. Jericho keeps referencing QRP and I don't know what that stands for.
Sorry,
question, persuade, refer. And so
Okay.
for the school systems, it's called an SOS program, but for that, they're doing the screening and the education, and then anybody who scores high enough on the list, the parents are notified and the child is assessed more deeply and spoken to, and a plan is created. For question, persuade, refer is more for the general public or specific targeted areas of the public. And it's more the education piece. It is not assessment.
And how does that get shared through the community?
basically, sorry.
ahead.
Basically, and correct me if I'm wrong here, Athelin, this is where people would sign up for these QPR courses. There would be 4 to 5. I'm not exactly sure the hours necessary, but there's a identifying signs of behavioral health issues. Then there's the persuade if there's immediate risk of harm to self or other. And then refer is a combination of knowing who to call and how to get the person to accept the referral.
So the reason they did QPR is it's like CPR, but for
Uh-huh.
crisis mental health, right? So if you think of CPR, it's the basic response that's needed to get somebody on safely to additional help for a mental health crisis.
Oh, good to know. It makes more sense now what you were talking about. Thank you.
Great. Any other questions about that, just before we talk about it anymore?
And we are running right up until the 1 hour mark right now.
We are. Couple minutes. So I think, Jericho, I will try to send Jackie your way for a one-off idea of trying to reach that population. And then maybe we can report back next month. Are we here next month? We're not here next month. Take yourself off mute.
I keep using the space bar trick and forgetting that I've done so. I believe the agenda item says guest for September.
Yes, you're right, September. So we then can follow back up in September and report what happened. Okay, great. Anything else that you have before? Oh, Tara, was that a hand or a scratch?
I was itch my nose.
Okay. Is that all you have for us today, Jericho? Okay, great. So now it's talking about a September guest.
So I do have Julia Kehoe. She committed to coming to the next available meeting, so we can definitely do that.
Do we want more than one guest speaker since we're missing August?
Sure.
I remember we had this discussion a couple of meetings ago about having 2 in September, and I had reached out to the adult programmer at the library, and I'm wondering, Jericho, did she get a hold of you?
I think I ended up speaking to her about a different project, but I don't
Okay.
know if we connected the dots.
I can, I also was talking to Ann Scott, who's the director at the library, and there was some interest in doing something in the fall about the programming. And she had put it into Sammy Aguirre is the adult programmer director, and she was very interested in maybe putting something together.
So if we extend an invitation to Sammy then to come in
Yeah.
September? You think that that would be something that Sammy would want to do?
I think that she would, and the adult programs, I work there part-time at the library, and I've taught all winter and there at night, and it's interesting, the influx of community members that we get coming to the different programs.
Right.
And QRP, sort of made a little inroad in my brain when you were talking about that.
Okay, okay. In the sense of that might be a place that it could be
Well,
done.
there's all kinds of programs, and we had, I know for for my classes this winter, there were a couple of men that came like right from work and came to programs. And it was very interesting that they were interested in the subject matter. And just for transparency, I'm an astrologer, and I was teaching tarot and astrology classes, and I had the highest level of attendance all winter. And I had a broad spectrum of ages and males as well as females.
Wonderful.
And it was, so I just see the potential of people having a place to come. And I know of other classes that men and teenagers were attending. It's such a great resource, the library.
Great. So we already have Julia on target for September. So Jericho, do you mind reaching out to Sammy Aguirre and seeing if we can get them on the agenda? Is everybody good with 2? I think we talked about that last time. Okay, fantastic. Let's do that. And then are we good to move on? Oh, you're still on mute.
Oh, no, I'm just talking to my phone to remind me to do that.
Oh. Sue.
I have a suggestion for a possible speaker in October, which is somebody from the Warming Place. It doesn't need to be me, but I think that might be a good timing wise, because we are hoping to open in November.
Great. Place for October. And honestly, if we're gonna do that, I might pair somebody from the food pantry.
Perfect.
I think that would be a good pairing.
Yes.
Okay, so we can talk
Actually,
about that. And food.
Beyond the food pantry, I think we should probably do fuel, food, and rental assistance.
Okay,
with
the whole
town
package.
organization. That would be a good pairing.
Let me just, I've run out of room. I've got it right in my margins. Okay. And I think that's really good timing for October. Okay, great. And if we're good, I'm going to move on to any other business. It's our next agenda item. Veronica.
Before other business, just if I can do a update, and if Sue wants to join me on this on the
For the
council-
CRC and youth.
CRC and
I
the youth
realize I skipped that now.
behavioral health grant. Things are moving along very well. We're very appreciative of the town of Nantucket in supporting this effort and our voters in supporting this effort. We are now beginning a new grant cycle for the youth behavioral health grant from 0 to 25. Right now, we have a survey that's available on the town website for agencies, and we'll be developing a survey coming up next for the community, basically asking what they like, what they would like to see, what's been successful, etc. And tomorrow, right now, we have the youth behavioral health request for expressed information out, which applications will be coming in tomorrow on that. And tomorrow afternoon at the library, the contract review committee is meeting with agencies and organizations and individuals that are interested in just learning a little bit more of what this is. And it's 1 o'clock, and I believe it's in the downstairs room in the library, not up in the great room. So that's at 1 o'clock, and there'll be, we'll be there to basically discuss the vision and what we'd like to see happening. And following up with that, the contract review committee will also request for proposals will be going out. And we hope to have everything in place with monies distributed for September. So things are moving quickly.
I think it's great that you're doing the kind of question answer for people, because I had somebody approach me just kind of out of the blue, saying that they had received something via email, but it was on FOMPS that they got it, and that they were so confused. So I had to share with them a little bit about what this was, but somebody just forwarded it to them and they were like very confused. So I'm going to reach out to that person and
Okay.
let them know that you're doing this at 1 tomorrow.
Okay.
And Athlon, if that is difficult for them to make it to, please send them my way. I'm happy to pass along any information I may be able to about.
Very good. Because I had mentioned a program that I wanted them to look at, and they said, well, it's funny you should say that. I got this random email and then showed me the email, and I said, well, I know what that is. So I will make the connection.
And possibly what where this is coming from, an email blast went out to the list of all organizations on the island. So it may have come out of the blue. I think that our public relations person for the town had done a beautiful job of writing up from our raw information, but it could come out of the blue if you had
It
no.
was a forwarded. Yeah, it was forwarded to her by somebody
Oh.
else, which is why it felt out of the blue, not the original. Yeah, no, somebody had received it themselves and then just forwarded it on to this person. So but I think it's going to be really helpful to have a session where people have the opportunity to come in and understand what it's for and who can apply. And so that's great that you're doing that.
And
Anything?
that's it for me. Sue, do you want to add anything more in?
And then I also see after Sue, Tara has a question.
Yeah, I just wanted to mention that as you talk, if you talk to people about this particular grant opportunity, that one of the main requirements for programs is that they will be done in collaboration. So at least 2 organizations need to be involved in the program. They don't have to both be behavioral health organizations. They might not either be behavioral health organizations. It's just a matter of trying to spread the word and get kind of everybody involved in addressing different issues with youth that could be just about feeling belonging, feeling invested in something, boosting their self-confidence. And so anything like
Also,
that. Yeah.
Any
Go ahead.
any pro-social activities, any third spaces for children to work out their own identities. We want to be as expansive as possible with this set of grant requests, because this is our chance to figure out what new interventions and programming can work where there has been failure in the past. So this is the experimental stage.
And I think that this was a perfect segue to our conversation on SOS and QPR, because the hope is that by offering robust programming and situations, our youth will not be at risk as adults and even as youth.
And I want to say that Sammy Aguirre, who will hopefully be speaking to us in September, has set up with Sierra, whose last name escapes me, but is also on the staff that works with the youth, the teenagers at the library. They have set up an LGBTQ prom night that's going to be happening. Some of you may be aware of it. And yeah, maybe they need to apply for some kind of grant in their programs too.
Suzanne, is that happening during Pride Month?
It's happening, yeah, it's happening on the 24th, I think, whatever the third Saturday is.
Great, great.
Yeah,
Thank you
yeah.
for that.
yeah, they've got
Okay.
lots going on.
Veronica? you have-
Suzanne, one of the thoughts that I had as you were talking about the library and, you know, being a year-round resident, you know, I constantly hear people saying, you know, it's January, it's dark, it's cold, and there's nothing to do. And the library and the programming that's done there that is free programming for the most
Free.
part is a wonderful place to find a community. So I'm thrilled to hear that you have a group of workers who are coming in after being on the job and participating in your program, because that may be enough for someone to
Mhm.
feel like they're connected, and as opposed to going home to an empty house or an empty room.
Or drinking.
Or drinking. And I was just gonna
Doing
say that
other things, yes.
we do have a couple of people that come for, you know, that are in sober programs, and then one of my students also set up another program that was held during the cold, horrible winter months. And it was kind of a fun one. And, you know, I didn't go to it, but other people came. And so there's a lot of pull there. There's a lot of, you know, going on.
Great.
I'm glad I'm not still driving in the dark to teach right now, though.
Well, we're looking forward to hearing more about the Athenaeum when we have this speaker. So thank you so much for that. And we look forward to having all of that discussed in the future. Okay, so I do want to just revisit other business just because I had forgotten, sorry about the CRC. So I just want to revisit. And Tara, did you have your hand up and we didn't get to you?
It's okay. It was sort of answered, so I'm good.
Okay, great. So I just want to, for a brief moment, move to other business to see if there's anything else.
If I can just make a statement, you know, when I joined the Council for Human Services, I felt like not quite sure what it was all about and where we were going. And I think in the last couple of months, when we've had speakers come in and we've had a wide range even so far, it is offering not only us as committee members, but to the public, a source of information that there's so much that is happening on this island, but you know, unless you happen to sometimes stumble over it, you don't know about it. So I'm just very, I'm feeling good about being able to look for September and November and October, that we're looking forward to bringing more people in. And I also want to thank everyone for who's participated so far, and maybe put a call out. And of course, I'm sending them your way, Jericho. If anyone is interested in using this platform, please let us know.
Right. And I'm going to dovetail on that for just a moment. Jericho, I know all of these are taped and available for people to watch, especially sort of right at the beginning of going into the more challenging seasons for people on the island. I wonder if some of the ones that we have, if there's a different way to at least blast out to the community that this is who presented what we were talking about. Please follow the link and find it this way. If we can do a little bit more active outreach to let people know how to access that information.
That is a big chunk of my day-to-day is going to be the outreach and improvements in terms of where you will be able to find things. A core chunk of that is coming hopefully in the next month or two, as our online directory gets reformatted into a combination landing page and directory, I will be asking probably you guys to contribute some content to that. And it could be recording videos referring to information or updates around services or at-risk time periods. I think I can be recording a ton of videos like I was back in the beginning of these things, but it's going to sound better coming from not me.
Right.
So I'm
And I
definitely
was
going to build a
thinking of- I
platform.
was thinking to make life easier for you, more just the blast out that, like, for instance, that September, we have Julia and Sammy on, and these are the topics. And just that section that says you can find it here with the link that somehow gets out to EDs who are running agencies who get it out to their, just really trying to make it as easy as possible. And even cutting through, not that saying the other things we talk about aren't important, but saying if you want to fast forward, you can go to 15 minutes point 2 to see the speaker. I want to make it as accessible as possible for people. Do you see what I'm saying?
Yes, I do.
Okay.
The good news, bad news on that is that we now have a communications department, which is working to actively popularize and communicate ongoing projects. We can definitely have the video to this meeting be shared on town social media immediately afterwards and then ongoing. The bad news half of that is that it's not directly in my hands anymore, and there's additional layers of complexity in terms of when, what, and where things go. But there are more eyes on it, and there's more resources at share.
And just thinking outside the box, and I have no idea how this falls, and I realize we're way over. So I'm just going to say this one last thing, and then we're going to move to adjourn. I know Jason does a piece on the radio for mental health. I just wonder if within the regulations of town, can he plug, if it has to do with mental health kinds of things, can he plug? And by the way, please see, or please go to the, I'm just thinking of how to really, people need it in front of their face, right? All the time as an option. And so I'm trying to think of how we work together as a full mental health, behavioral health community to consistently plug each other as well, so that people.
Well, I believe Jason has stepped down from his select board position, which
No,
now
not select board. He does it on the radio
for Fairwinds. Yeah. And he's also, he and Fairwinds are members of the CSBH Alliance. So we can absolutely be asking for specific things into his regular addresses. I also do have a radio or an advertising budget, which means that, again, assuming it's approved by the town's comms office, et cetera, we can be directly putting radio messages in. I think we get a certain amount of free ones as part of our relationship with whatever the umbrella media org is there. So I can supplement that with some
So
of my.
maybe we need to start putting on our agenda what topics we would want to maybe do a blurb about on the radio, especially.
Yeah, in the past, Nantucket radio station, whatever it's called, I forget, had PSAs. And I mean, you know, they were free. And you could, talk to whoever's in charge over there at that.
Thank you.
We can
As well
definitely
as another
we-
really good resource is NCTV Channel 18. They have tons of programming for the schools, and they also have things that you can put on the website and, YouTube videos and everything.
Great. Thank you, everybody. I think we should consider Veronica.
Thing, can we have the date for our next meetings, the next two meetings before we leave?
Okay, so yes, and I want to say I'm going to be a little squirrely because I'm going to have just moved. So there may be the potential that I need you to chair the meeting in September, only because I don't know what that's going to look like
Okay,
for me. So
Pardon me,
let's
guys.
make sure we pick a good date for you.
Okay,
Just before we get into the nitty gritty of the dates and times for the next two meetings, we should probably allow Sarah to get back to her day.
oh, gosh, thank you.
Oh, no,
Unless
I'm fine. I'm
unless you
fine.
wanna
I'm,
know when the next two meetings are.
All right, no, if you'd like to know, that's fine. I just didn't want you to.
thank you.
I know for certain, let me look at. Oh, well, we're meeting in July. No, we're just moving straight to September.
No,
So
aren't we doing a half-hour
we're
meeting
gonna do a half hour in July?
or August? What was,
No, I think we had discussed not meeting during the summer. Am I accurate with that, Jericho? Right,
As I remember it, we were intending to table it for the next 2 months, but I cannot remember 100%.
okay. So September,
mhm,
we've talked about consistently having the same
mhm.
day of the month, the same second or third or whatever it is.
And Jennifer noted that there was the Thursdays were not good for her. Do I have that right? Or was it just a specific Thursday?
There was a specific Thursday that didn't work for her. I believe it was the third Thursday of each month was
So the
was
one
not
we do.
okay. Yes.
Okay, so do we want to maybe change it to the second Thursday?
Which would be September 14th.
14th, yeah.
Can everybody live with that?
Yep.
That's good for me.
As of now,
September 14th. And right now, Veronica, I can say that date doesn't conflict with anything I have, but I will keep in touch with you
And I,
about
that's,
that. So 4:30. How has 4:30 been working? Is this okay?
Yeah.
Good.
Okay, and we'll plan on an hour.
okay.
And just for Sarah's purposes, we usually do not go over. But since this was the last one and we had some business we really had to take care of, I'm usually a stickler on us ending on time. So I just want you to know that in case you're considering putting your name in the hat.
No, it's really great. You know why? Just listening to you talk about all these different things. I just followed the TV station on Twitter. I just followed a bunch of other things on Twitter. So I feel caught up.
Great, great. Okay, can I have a motion to adjourn?
so moved.
Thank you, Sue.
Second,
Second, thank you, Veronica. And roll call vote, Sue,
Aye.
Tara,
Hi.
Suzanne,
Aye.
Veronica,
aye.
and I. So we are done.
All right.
Thank you very much, guys.
everybody.
Thank
Sarah,
you.
it was
Happy
nice.
summer, everybody.
Yeah, happy
Sure.
summer.
Thank you.
And as always, if anything comes up over the course of the next 2 months that is town related and you're like, why the heck are they doing that? Please feel free to reach out to me.
Okay.
And Jericho, can you send out some reminders just for everybody to be thinking about who might be good fits?
Will do.
Just especially since we're not meeting.
Yeah.
Okay. All
Thank you.
right.
Have a great
Have a
night.
have a
Thank
great
you.
summer. Bye-bye.
Bye.
Bye.